When was the last time you were here at the doctor's office? Making regular trips to the doctor, and not just when you're sick, is an important part of staying healthy. With us today to talk about our annual well visits and what to do if you don't have a primary care doctor is Richard Morrow, a nurse practitioner with LeBauer Healthcare at Summerfield Village. All right, so first off, let's talk about this, because sometimes, you know, medical people, healthcare people, they use things interchangeably, and we don't know if they're the same or not. Is an annual wellness visit the same thing as a physical?
So by and large, yes, for most of our population, we do make the distinction with our Medicare patients. The Medicare annual wellness visit will have its own distinct set of requirements, but by and large, if you're making it in for an annual visit to see myself, your own primary care provider, or maybe a primary care provider you've yet to meet, yeah, we want to see you at least once each year.
Okay. All right. So let's talk about this. Who needs to get an annual wellness check? Are we talking about children, adults, both?
In short, everyone. You know, it's important. A lot of these wellness visits are looking to discover these things that we might not know about yet. They're looking for that early intervention and prevention.
All right. So it's not just for those 65 and older, like you heard him say about the Medicare benefits. How important are annual wellness visits?
They're crucial. They're a lot of the foundation of the decisions we make for the rest of the year. You know, I know you'd mentioned a lot of folks want to come in and see me when they're sick, and
Yep.
that's all well and good, but I'd prefer to see you even less frequently. If we can take further steps to make sure you're getting sick less often, I want to take every step we can to make sure that's the case.
Okay. So this is what we hear all the time. Like when we bring this up, I feel fine. I don't need to go to the doctor. What do you tell them?
That's the exact point, is I want to see you for these regular physicals when you are feeling fine. I don't want to work on existing issues. I want to dig up new problems. I want to find new things that we need to worry about, or hopefully make sure we have nothing more to worry about. Those are the times when you're feeling fine is the best time to come in for your routine physical.
All right, let's get some examples here, right? Because people want to know, all right, like, so what? Can you give me some examples of what maybe people have learned during these visits that maybe was surprising?
Right, right. So a lot of insurance companies will make it a requirement or at least provide some incentives for patients to get their annual physicals done. I see some of these patients who say, I feel fine, but my insurance company needs me to be here. My employer asked me to be here. And well, when you know it, maybe their blood pressure's been a little bit high, and we know that blood pressure, you don't feel your blood pressure if it's just a little bit high, but your kidneys feel it, your heart feels it, your organs feel it, and we unfortunately, you know, every now and then we'll catch a case of early kidney disease, and maybe this is a case where we can put off dialysis for years if we intervene in this situation in somebody's 30s or 40s rather than waiting until their 60s or 70s.
Okay. Now, why are the recommended yearly even for someone who might be, I mean, really just young and healthy? You're talking about, you know, those early 20s, early 30s, and they're like, meh.
Yeah, unfortunately, when it comes down to the things like high blood pressure, high cholesterol, oftentimes thyroid disorders or autoimmune processes, these are things that start to rear their head in their 20s. This early intervention oftentimes prevents later complications, and we can also do more with lifestyle interventions to prevent these changes from taking any real consequence on the body. So, if we really can buckle down and making sure we're sort of fine tuning your diet, your exercise, your relationship with health early on, that's less often you have to spend with me later on.
Right. And sometimes we have all of those questions that we'd like to ask a doctor, but we're not in the wellness visit. So that would be a really good time to get them all out. All right. We're going to take a quick break. We're going to come back and we're going to continue to talk about annual visits and some other points to be made about that as well.